Well, when a patient comes to see me, if they're coming to see me for a problem with their shoulder or elbow, we want to first identify what's the source of the problem. Is it the shoulder? Is it the elbow? A lot of times it may be a pinched nerve that is causing pain down the arm. So we have to identify the source of the issue. So that would involve getting an x-ray of the affected area, doing a physical exam, and determining what the source of the issue was. From there, we would consider some sort of treatment depending on what the problem was. Usually we try to treat things as simply as possible with maybe some medications or an injection. And a lot of times we will do some therapy, whether it's a self-directed program where you're doing your exercises on your own, or a formal physical therapy, seeing someone a couple of times a week to get a program together specific for your problem, and going from there. If the problem does not resolve, possibly considering something surgical for that. So non-operative solutions for problems with the shoulder and elbow include injections. A lot of times we'll do a corticosteroid injection, but there's a lot of newer techniques and treatments that we can use for injections. One of them, particularly for arthritis, is the fancy term is viscoelastic supplementation. A lot of people know them as gel shots. Most people know them for knee arthritis, but we do use them in the elbow and the shoulder with reasonable results. It's less common to do it for that than the knees because there's a lot more knee arthritis out in the community than shoulder arthritis, but we do use it on occasion. Another interesting technology that's available to us is something called PRP, which stands for platelet-rich plasma. That's something that comes from our own blood, and we concentrate the platelets and plasma, which are the parts of our blood that heal things. So we try to inject it into the area that's damaged or irritated to try to reduce the irritation and help the body go through the healing process to reduce the pain. And another newer technology is stem cell technology, which a lot of people have heard of for various uses. We can use it in the same areas for arthritis or for tendon problems to try to, again, reduce the pain associated with that problem. And then we also try to incorporate exercising and therapy into the non-operative management of these different problems to help resolve the issue. Sometimes people don't respond to non-operative treatment and we have to discuss surgical treatments. And depending again on the problem, there are lots of different options for surgery. If it's a tendon problem, it might be something as simple as performing kind of a clean out or debridement of the area to get rid of the irritant in the shoulder or the elbow. Sometimes we have to fix something, repair it surgically, and that obviously would be a little bit more involved, and also the recovery is a little bit longer for a repair of something. And ultimately, the problem might be arthritis, and we do treat arthritis of the shoulder and elbow, and that might require a replacement of the shoulder or the elbow. More commonly, the shoulder gets replaced, and within that realm, there's also two types of shoulder replacements that we're typically doing now. One we call an anatomic replacement, which is the more traditional replacement that looks like our joint. So form follows function. It's designed to try to replace the arthritic parts of the shoulder with metal and plastic, as we do in hip and knee surgery, to create a smooth surface that doesn't produce pain when moving and improve the motion and function of the joint. The reverse shoulder arthroplasty is a more specialized type of replacement that's used for people that have not only arthritis, but also a second problem of having no rotator cuff. The rotator cuff is torn or it's not functioning properly, and that creates a second problem that the anatomic replacement cannot address. The reverse was designed to address both problems, to help stabilize the joint, to not only get rid of the arthritis, but also to compensate for the rotator cuff and help the muscles that are still working work better to move the shoulder. Well, certainly delaying care can make the problem worse. The problem can start off as small and then get bigger. Particularly the rotator cuff is a perfect example. We know that it goes through a series of stages. The first stage is tendinitis or bursitis. It's simply inflammation of the area, a mild irritation. Left unchecked, that typically will develop into a tear. And that tear it will progress with time. So the rotator cuff is a series of 4 muscles around the shoulder. Typically, somebody gets a small tear, and then over time, that becomes a weak spot, and the tear will progress and will get bigger and bigger. And smaller tears, we know, are easier to fix and address if it needs something surgical. Larger tears are harder to fix, and they take longer to recover from. And as I mentioned before, having a rotator cuff problem, a tear, can lead to arthritis in the shoulder, and then ultimately the only solution for that is the replacement. So you can go from something very simple, being a clean out or debridement that we discussed, to something more complex, being a rotator cuff repair or replacement.